The centre was set up originally in 2013. It was a commitment which Welsh Government ministers made to establish an organisation which would help them to get access to expertise in academia. I think what's important is to understand what the demand for evidence is. So very often we as academic researchers start with our own agendas and then towards the end look to see whether there's any relevance for anybody else in the work that we've been doing. And a different way of doing it is to start by understanding the policy challenges which governments are facing, the evidence which they think would be useful if they knew about, and then trying to generate that evidence without compromising the independence and the rigour of your research. So it's a demand-led approach. It's something which hasn't been very widespread in academia. I mean, there are pockets of it, but very often depends on individual academics and their own personal links to policymakers. And what we're trying to do is to put in place an infrastructure which makes that much more systematic, so that the person who the minister calls in doesn't just happen to be somebody who she's heard of before, but is hopefully the best available expert, certainly in the UK and maybe the world, for the particular issue which they're interested in hearing about. So first of all, we talk with ministers about their perspective on the issue, what it is that they feel that they don't know, that they would like to try and find out if there's evidence about. We then have a series of discussions with their advisors and the civil servants working with them to better understand work that has already been done or which civil servants might be producing, because it's very, very important that we work in a complementary way with the civil service rather than being seen as a competing source of policy advice. And then we would read quite widely around the topic. We spend 3 or 4 weeks on Google Scholar and on other databases reading up anything that we can find in the academic literature and beyond. We get on the phone and we get on Skype to people who we identify as having expertise in the area. And then, having done all that, we go back to ministers with a proposal about how we think we can help meet the evidence need. And that might be to produce an evidence review, a report which we would present to them, and or we might bring together a group of experts for a round table discussion, and we organise quite a lot of facilitated discussions, 2 or 3 hours, academic experts in a field with civil servants and others, really thrashing through a set of issues to understand what the evidence is and how that can help inform it. And then, really importantly, towards the end of a piece of work, we're probably meeting with the minister, maybe with some experts, to talk with them about what we've found, and we make sure that everything that we produce is public and published, so that our work is transparent and not happening in some sort of secret way simply on behalf of the government. And we find that's really useful because it means that other people, opposition parties, local authorities, health boards, academic colleagues can all have a look at what we've done. That's important to safeguarding our independence and making sure that the work we do is rigorous, because other people can read it and review it, and if we weren't following the evidence properly, we'd soon get to hear about it. The relationship that we have is absolutely key to the success that we've been able to achieve. We've invested a lot of time both in understanding the kinds of issues that ministers are trying to tackle, knowing when it would be useful for them to have evidence so that the evidence is timely and available when they actually need it, working really hard to make sure that the evidence is presented in ways which are readily kind of accessible to busy policymakers and officials who don't have time to read academic journal articles, even if they were inclined to do so. So we work hard at making sure there isn't academic jargon in what we produce. So relevance, timeliness, and I think the relationship of trust, which means that we're not going to kind of speak out of turn, I suppose. We present the evidence impartially, but we do it in a way which we hope is helpful rather than unhelpful. I think our position, working closely with government but outside of the government and with some degree of independence from it, is really important in a variety of ways. Firstly, it enables us to take a step back from some of the questions which ministers are asking us in a way which would be much more difficult if I was employed directly by the government. So it enables us maybe to be a bit more questioning and challenging about some of the evidence needs that are identified to us. But I think crucially as well, the fact that we're based in a university, that many of us are academics by training and background and profession, means that we understand the pressures which are on academic colleagues and the reasons why they don't always find it easy to engage with policy and practice. So we can provide a sort of bridge between these two sometimes quite different worlds of policy making on the one hand and academic research on the other, speaking the language of the professor but also understanding what it is that the minister is looking for. So a lot of the work that we do is drawing on expertise in England, Scotland and or much further afield. So we work with international experts as well. And very often we're looking at what's worked elsewhere which might be transferable to Wales and what would we need to take into account if we were going to try and implement it in the particular context that Wales is operating in. And equally, some of the work that we do is read in England and Scotland, and we've heard from people who are saying, look out for your reports because they're really very valuable. So I think there is interchange both ways, and that's part of what we've been trying to do, because the economic and social and environmental challenges in Scotland are similar to Wales and England and Ireland and Canada and France. So it's foolish for countries to try and reinvent their own solutions all the time. We're part of something called the What Works network, which the ESRC funds quite a large number of What Works centres, and that's been really important to us to be able to draw on the expertise of colleagues in a range of those centres and encourage them both to think about the Welsh context but also to come and share their insight and their evidence with policymakers here. One of the reasons that centres like ours are so important is because there's a real risk that all of the fine academic research which is going on in our universities here in the UK and elsewhere just doesn't get used properly because policymakers aren't aware of it, or if they are, they don't really know how to access it. And so it's important that there are ways of mobilising all of that knowledge and expertise which is often locked up in the ivory towers of universities and doesn't have the impact that it could do. I wouldn't claim that evidence should be the only thing which determines the kinds of decisions that politicians make on our behalf, but I would say that it clearly should be in the mix. And so for ministers to understand what evidence there is about what works can be really very important in helping them to make informed choices about which policies to adopt. Sometimes there isn't reliable evidence, and if that's the case, we're clear about that. Sometimes the evidence is mixed, in which case we present to ministers both sides or all sides of the story, and we often take experts to meet with civil servants and or ministers to really talk through an issue and to talk about how evidence from somewhere else might apply or not apply in Wales. So it's not straightforward that you can say definitively what's going to work in any particular policy area, but I think having evidence available helps a much more sophisticated process of deliberation, which ought to lead to better decisions and better outcomes for people in Wales.